Hello friends, after a long time, now I am restarting this channel and now I will keep on posting new videos regularly, and I have planned to classify the videos according to different playlists. For example, there will be a separate playlist for medical students which will consist of the videos related to the pharmacology, medicine, new drug and new therapy updates, and explanations of the NEET pattern PG entrance questions. And moreover, there will be another playlist for the common public and everyone, which will consist of the videos related to overall health and fitness. So now, today, we will discuss some important image-based NEET pattern questions from general pharmacology. So please listen to these questions and their explanations attentively. So here comes question number one. Till what date the drug salbutamol can be used according to the strip shown in the image? Option number A is 14 July 2017. Option B 31st July 2017. Option C 17th June 2014. And option D is 30th June 2017. So friends, according to the strip shown in the image, the manufacturing date is July 2014 and the expiry date is June 2017. And remember, the drug can be used till last date of the month of the expiry date. Hence, this drug can be used up to 30th June 2017. So the option D is correct here. And side by side, you should also have a brief idea about the drug expiry date. The drug expiry or expiration date is the date after which a drug might not be suitable for use as manufactured, because after the expiry date, drug may decompose, may lose its previous quality and effectiveness, and or may even become harmful or toxic. However, the published expiration date is not an absolute indication that a drug has spoiled, has become ineffective, less effective, or toxic. That is, drug may still retain its previous quality, but there is no guarantee of it. It means there is no certainty of its quality. That is, after the expiry date, quality of medicine is not assured by the manufacturer. And side by side, you should also know the meaning of the term use by date. If your medicine has a use by or use before date instead of an expiry date, this usually means that you should not take the medicine after the end of the previous month. For example, if use by date is July 2024, it means you should not take the medicine after 30th June 2024. And yes, we also find the term best before on various food products. There is a difference between use by and best before. So, with the term use by date, the main concern is safety. Use by date indicates a product may no longer be safe to eat. If we are talking about food products, you should not eat, cook, or freeze it after the date displayed, even if it looks or smells fine. Whereas best before dates are an indication of quality rather than safety. You can still eat food after its best before date, but its flavor and texture are most likely not as good as before the date. Use by dates are typically present on high risk foods, for example, fish, meats, and prepared foods and dairy products, as well as ready meals like salads. Always follow the storage instructions on the product, usually refrigeration or freezing. Otherwise, it may no longer be good to eat even before its use by date. Using food after its use by date can put you at risk of food poisoning. So, make sure you pay attention to what the date on the label says. Food that have passed their use by date may still look okay to eat, but harmful bacteria cannot be seen and does not have a smell. Foods labeled with a use by date should be checked daily to make sure they are still safe to eat. Freezing food before its use by date extends its life. And if we are talking about the term best before, here the main concern is quality. That is, time for which a food will be at its best quality. They appear on a wide range of foods which have a longer shelf life. These foods include fresh, frozen, dried, and tinned foods. For example, dry pasta, bread, tinned products, fruits and vegetables, and uncooked rice. Best before dates are usually displayed on the products that do not require refrigeration or freezing, and food that has passed its best before date is not unsafe to eat, but it may lose some of its flavor, texture, and quality. And you should also know that to determine the expiry dates of drugs, certain stability testing studies are performed and then an expiry date for that drug is suggested. The testing is designed to provide confidence that the product will meet the applicable standards of strength, quality, purity, and safety throughout its shelf life. And yes, you should also know that Schedule P of the Drugs and Cosmetic Rules 1945 contains regulations regarding the expiry date and life period and storage of various drugs. Now the next question based on the same image is, according to this image, the shelf life of salbutamol is option A 3 years, option B 14 years, option C 5 years, and option D cannot be known from the information. So actually, shelf life is the time in which drug can be used, that is from manufacturing date to expiry date. And in this image, manufacturing date is July 2014 and the expiry date is June 2017. The time span from July 2014 to June 2017 is 3 years. So the shelf life is 3 years. So option number A is correct, that is 3 years. And the next question is, expiry date shown in the strip of the tablet means option A. If this preparation is used after July 2017, it will lose its potency. Well, it may lose, it may not lose. We cannot be certain of it. Option number B. If this preparation is used after July 2017, it will become toxic. So it may become toxic or may not become toxic, but we cannot predict it. Option C. Quality of this medicine is not assured after July 2017. Yes, this option is correct because we are always discussing that there is no certainty or no assurance of the quality after the expiry date. So this is the correct option. And now the next and the very important question which comes from AIMS November 2016 exam is, which of the following is not necessary to be mentioned on drug advertisement literature? Option A, expiry date of the drug. Option B, references of the information. Option C, rare but life-threatening adverse effects. And option D, common but insignificant adverse effects. So, well, friends, drug promotional literature or DPL consists of pamphlets or brochures printed by pharmaceutical companies in order to promote the sale of their products. As such, DPLs represent a major marketing technique. And regarding DPLs, WHO has prescribed certain ethical guidelines. According to these guidelines, the printed drug promotional literature must contain name of the drug, that is brand name should be available with the active ingredient, that is generic name, and indications of the drug and dosage, that is content of active ingredients, per dosage form. For example, every 5 ml contains 100 mg of the active ingredient, and whole regimen also. For example, 5 ml twice a day for 1 week. And also precautions and warnings, then contraindications and adverse effects. All serious adverse effects and common non-serious adverse effects should be mentioned, and also major interactions. Also price and information of the manufacturer, that is the name and address of the pharmaceutical company or its agent responsible for marketing the product must be present on this DPL. And last but not the least, references to the scientific literature. It means appropriate references should be available regarding the claims made by the DPL. So after this discussion, if we go back to the question, we find that mentioning the expiry date is not needed here. Now, coming to another very important question in this context. This question is from AMS November 2015 exam. And the question is, the meaning of store in a cool place written over a strip of medicine is that it should be kept between temperatures, option A, 2 to 8 degrees Celsius, option B, 8 to 15 degrees Celsius, option C, temperature below freezing point of water, and option D, 0 degrees Celsius. So here you should know about the recommended storage conditions according to WHO, and WHO has prescribed good storage and distribution practices for medical products. So according to these guidelines, number one, store at controlled room temperature. It means 15 to 25 degrees Celsius. Number two, store in a cold or cool place. It means 8 to 15 degrees Celsius. Number three, store in a refrigerator. It means 2 to 8 degrees Celsius. Number four, store in a freezer. It means minus 15 to minus 25 degrees Celsius. Number five, store in a deep freezer. It means below minus 15 degrees Celsius. And number six, store in a dry place or protect from moisture. It means no more than 60% relative humidity. And lastly, number seven, protect from light. It means product is provided in a light resistant containers or store in a light resistant cupboard or drawer. So in the question here, the meaning of store in a cool place has been asked. Thus, according to these guidelines, option B, there is 8 to 15 degrees Celsius is correct. Moreover, you should also know the meaning of the term relative humidity used in these guidelines. A relative humidity of 100% means that the air can't hold any more water vapor. It's totally saturated. When this occurs, it can rain. So what's the comfortable humidity level? Studies have shown that we tend to feel most comfortable at a relative humidity of around 45%. So if you find this discussion helpful, you can like this video, comment your views, and you can also share this video. And most importantly, if you have any query or any confusion from first chapter to last chapter, that is from the entire syllabus, and I would also like to tell the general public that if you have any health or medicine related query, you may write it in the comment section or you may message or email me. For that purpose, email address has also been provided in the description box, and I will keep on making separate videos based on these queries. So stay connected, and soon I will be back with the next video. Thanks for watching.